Welcome to our comprehensive guide on Botulinum Toxin, a popular cosmetic treatment known for its ability to reduce wrinkles and rejuvenate the skin. In this video, I will be referring to botulinum toxin as Botox merely for ease, and also because this is how it is most commonly known across the world. This is not to be misconstrued as a personal endorsement for any particular brand or a pharmaceutical company. In this video, we will delve into the science behind how Botox works, its common uses, and its numerous benefits it offers. We'll guide you to what to expect through the procedure, how to choose a qualified practitioner, and the essential post-treatment care and tips. Additionally, we will cover potential complications, how to avoid and address them, and dispel the many common myths and misconceptions that are surrounding Botox. So whether you're considering Botox for any cosmetic or medical reasons, this video will provide you with all the information that you need to make an informed decision. So stay tuned for expert insights and medical advice on integrating Botox into your long-term skincare routine. So what exactly is Botox? Purified botulinum toxin that is used for cosmetic purposes is a highly potent neurotoxic protein that is produced by a bacterium called Clostridium botulinum and its related species. So it works by blocking the release of neurotransmitters from nerve endings which are responsible for muscle contraction. So how does this work as an anti-wrinkle treatment? See, facial muscles are very different from skeletal muscles that you find on other parts of the body. And that's because the facial muscles are much more finer, they are thinner, they are interconnected to each other, and then they connect directly to the skin. So it allows the facial skin to contract and show emotion every time you flex these muscles. So for instance, when you're happy and you smile, you contract the muscles of the orbicularis oculi and those crow's feet will appear. When you're frustrated and you frown, your procerus, your corrugators and your nasalis will clench and that frown lines will appear. When you're surprised or you're shocked, your frontalis muscles will elevate and those frown lines will appear. So when injecting a few drops of Botox at those precise points will relax those muscles and the appearance of those wrinkles also will start to go away. So no, Botox will not really paralyze this muscle, not at the doses used by a dermatologist who knows what he's doing. Neither is the effect permanent. After your treatment, those lines will begin. You'll notice that the lines are starting to fade away in about 48 hours, but the peak improvement will be noticed after about a week. If your doctor is well trained and experienced, if they are using a product that is approved, that has been stored at the right temperature, and that has been diluted accurately, then the results are guaranteed, and it will definitely last for at least 3 months, and it may last for up to 6 months. When it is injected into the masseters, the results are a bit slower to become noticeable. It usually takes about a month or so given the bulk of the muscle, but the results may last much longer, say about 6 to 9 months. It perhaps lasts the least when it is injected under the eyebrows for a brow lift or the perioral lines. Here the results only last for about 2 or 3 months at most. So what are the common uses of Botox in dermatology? The most popular uses are, of course, to treat the lines of expression on the upper face. So namely the frown lines, the forehead lines, the crow's feet or the bunny's lines. So by extension, these injections can actually also relax your migraine headaches. In the lower face, Botox has been used for what is popularly called the Nefertiti facelift, named after the beautiful Egyptian queen Nefertiti and her enviable jawline. So the Nefertiti facelift, this involves injecting the masseters in the jaw to soften and slim a square jaw. A few drops are injected along the cords of the platysma on the neck and a few points of insertion of the platysma along the jawline. So this will give you a defined jawline and relax those neck creases as well. Botox can also be injected into the depressor anguli oris to relax those droopy or sad-looking lip corners. And it has been used to relax a poppy chin or a gummy smile. Most interestingly, Botox injections can also relax the nerve signals that control sweating. So it has been used successfully to provide lasting relief from hyperhidrosis, that is excessive sweating, especially in the underarms and palms. So why should you choose Botox over fillers or threads or skin tightening devices? Well, it actually really depends on the indication that you're trying to treat. So for instance, if you're looking for a solution for your crow's feet, Botox is the only solution. No amount of under-eye cream or threads is going to fix that. But Botox cannot address volume loss like fillers. So if your problem is sagging or excess bulk from facial fat, then for instance you need hypho. If your skin is aging mostly in the form of pigmentation, then you need pico lasers. So aging faces after a point of time will eventually need a combination of procedures to address all the concerns effectively. The key is to understand the difference between dynamic and static lines. Dynamic lines are the lines of expression that come on a young face only when the face is in expression or animation. So when a young face is neutral, no expression, no wrinkles. But with repetitive use, repetitive smiling and frowning over the years, these dynamic lines will get etched into permanent static lines. These are permanent creases in your facial skin. And when those permanent lines come in, then Botox is less likely to give brilliant results. So don't be too offended if you're in the 35 to 45 age bracket and your dermatologist recommends Botox. No, you're not too young to get it done. So who should be performing my Botox procedure? For safe and effective results, it is important to understand that your treating physician needs to have a thorough knowledge of facial anatomy and a complete understanding of botulinum toxin, its action and its uses. So you should choose a dermatologist, a plastic surgeon, an oromaxillofacial surgeon, an oculoplastic surgeon, or a dental surgeon who has been specifically trained in the use of Botox and has at least 2 years of experience practicing this under the guidance of a qualified and experienced senior. Do bear in mind that even at the hands of the best of doctors, even they can rarely have a complication. But only a qualified and experienced doctor can correctly address and rectify these complications. So what can you expect during the procedure? Well, the procedure actually begins with a consultation. And as with any procedure, big or small, do not try to get a consultation or an inquiry done over the phone or email. I mean, this is the first step of the treatment. So this needs to be done in all seriousness in office. And you must give it its due dignity. You never know what contraindication might turn up. If this is your first time getting Botox done, most doctors would not prefer to go ahead with the injections on the first day of the consultation itself. Take your time. Don't rush the doctor. Go through the literature, go through the consent form, and then come back once you've made an informed decision. Typically, a numbing cream is not required. It's mostly just a placebo if someone's very nervous about getting injections done. I myself have a mild case of needle phobia. The thing is, if you use a numbing cream, you may not feel the prick of the needle, but once the toxin gets into the skin, you still feel that bit of a sting that goes in. Then what is to keep in mind? Now, some of the shots are done directly into just under the skin, like when you're injecting the crow's feet. And some of the shots are done into the bulk of the muscle, like when you're injecting the frown. So those shots can be a little more painful. But your doctor might have a few tricks up their sleeve, like we can use ice cold rollers, we use little vibratory devices, maybe a little stress ball for you to hold, or we keep chattering away, we call that talk aesthesia, little tricks that we use to keep you distracted from the pain. Now, what are the side effects and risks that I need to keep in mind? The most common side effect could be little bruises. These just fade away on its own in a week or so. You can hide them using a little makeup. They will anyway go away in a week or so. Injecting the frown can sometimes lead to eyebrows poking, and people hate looking like surprised eggs. But that can easily be rectified at your touch-up session, which is usually scheduled a week later. We never inject the forehead without injecting the frown. This is most likely to lead to eyebrow ptosis or drooping of the eyebrows. And this can be avoided by correct injection techniques. In fact, with the right injection techniques, a woman with a flat or sad-looking eyebrows can be given sharper eyebrows and the lifted look. The most unacceptable side effect is when the eyelid itself droops or when the smile deviates. Although this will resolve in a month on its own, I can imagine that this can permanently put a person off the idea of ever getting Botox done again. This usually only happens because of poor injection technique. The only other issue is once you've been getting Botox done regularly over a period of a few years, the muscles that we do not inject, like for instance the part of the orbicularis oculi right under the eyes that we don't inject, this might start to wrinkle and hypertrophy to compensate for the lack of movement in the lateral component. But there are a few tricks to address these concerns as well as your dermatologist begins to notice them. What are the pre-treatment precautions that the patient needs to take, and what is the post-treatment care? So those are fairly simple. If you want to minimize your chances of bruising, avoid painkillers, avoid anti-inflammatory drugs, green tea, vitamin E, fish oils, and ginseng for about 2 or 3 days before the procedure. If you are on essential blood thinners like aspirin or warfarin, please seek clearance from your physician or cardiologist to check if it is safe to go off the blood thinners for about a week prior to the procedure. If you have had your upper face injected, remain upright for the next 4 hours. Practice your muscle movements. You practice your frown, your forehead, lifting your eyebrows, your smiles, every few hours for the next 24 hours. No jumping or bouncing activity for the next 24 hours. No massage, steam, sauna or facials for the next 24 hours. Some people may get a headache in the 24 hours after a procedure, and if you need a painkiller, just take a paracetamol. There are plenty of myths and misconceptions. The most common one I hear is, I don't want to get this done because I don't want to look plastic, I don't want to look frozen. See, we may rarely get a patient who actually wants to have a completely porcelain forehead or a completely poker face for the boardroom or whatever, but these requests are very rare in India. Yes, you'll still be able to smile and express surprise, anger, sarcasm or disgust, if you want to, but just without all those wrinkles. See, do bear in mind that Botox treatments are often sought out by actors and performing artists, clients who actually wish to retain these facial muscles, just without all those wrinkles coming up. A myth: Botox is only for women. Fact: it is a lunchtime procedure. Myth: if you stop, your wrinkles will get worse. Fact: actually, if you continue with Botox, it can stop new wrinkles from appearing. Myth: it is only used by people looking to fix cosmetic problems. That is so ignorant. Fact: in the right hands, Botox actually has one of the highest safety profiles of any other cosmetic procedure in the world. If you like this video, please go and visit the website DermaVidya.com. But bear in mind that these videos are made for general public information. Do not try to self-medicate based on any of these videos. Please always consult a qualified dermatologist. Thank you.
For more such videos, visit or log into DermaVidya.com.